Good morning everyone, my name is Richard. I'm an ENT registrar and I've been invited by Lucy to have a chat with you guys in regards to tips and tricks and pitfalls to avoid as an intern from a registrar's perspective. So what I really want to talk to you about is the main focus here is communicating, because I think communicating is key in any level of the job as a doctor, as an intern, resident, registrar, or even a boss. I think that's key, and it's important to develop good habits early on to make sure that you're a good doctor that communicates and collaborates well with other people. So all my advice or all my tips are all based on my own experiences, what I found helpful, what I didn't find helpful, and the things that I found that needed to improve in the last few years that I've been working as a doctor. So the way that I've developed this was through working with different people and seeing from me what works and what doesn't. So you should take my tips in consideration with your own work style and your other registrars' work habits, because you'll see people practice different things. You'll see what you like and you see the things that you don't like, and you cherry pick different things that you like about a certain person or the other person and implement them to your practice. So we'll start off in regards to communication. We'll start off with communication, which is a big umbrella term, but I'll talk through about how the normal day goes from pre-ward rounds until the end of the day, including operating theatres, because I'm a surgeon. So what I would like or expect as an intern is doing a quick pre-ward patient read. So come about 10-15 minutes early, have a bit of a quick look on the patient notes, see what happened with them overnight. So if you have 10 inpatients, you can easily come 15 minutes and quickly scroll through the notes. Look at the OBS, look at if there's any clinical reviews that needed to happen overnight, and see if there's any concerns raised from nursing staff. So don't just immediately filter through physician notes, but also read at the nursing notes as well, because they give valuable information in regards to how they're faring on a day-to-day basis. When I come, or when the team comes, a thing that it would be good for me and what I found very helpful to the team as well, if you have a quick summary as we walk in before we start the rounds. So you can, an example would be, hey guys, just an update of the patients overnight. Patient A had a desaturation episode tachycardia, ward call was called, this is what happened. Patient B had a met call, this is what happened, he's now in ICU, these are the blood results. All other patients are fine. No other big issues or big dramas to talk about. So that sort of sets you in a good frame of mind, like me as a registrar. Okay, now I know which patients I really need to focus on and prioritize talking to the boss. And it sets a good tone to start the day as well, because we know exactly what we need to do in the morning. And we can sort of allocate our jobs as well. The other thing as well that would be good for you to learn is how to lead a ward round, because eventually that's what you'll have to do as a resident or a registrar anyways. So often leading a ward round, you print out the patient list, sort of find a good route. How do we have a good single one-way route to see all the patients without backtracking? Because often in a big hospital, for example, it's such a waste of time to backtrack 5 or 10 minutes just to see that other patient because you missed it. Ultimately, depending on the registrar, they'll want the intern or the resident to lead the round. So I think it's quite important to, at least within the first month or two, notice how your registrars structure a ward round, lead the ward round to make it as efficient as possible, so that we can go through the consults later, and for yourself, do all the jobs as quickly as possible. Now, once a ward round is done, then you guys will have a list of jobs. I think the thing to keep in mind here is triaging the jobs. In ward rounds, if you're not sure what the plan is or we're going too fast, I tend to go quite quickly. Ask. Don't be too afraid of asking, what do you want me to do for this patient? I'm not too clear. Why do you want a CT scan? Because often, when you ask for a CT scan and ask for a consult, you don't know a reason why, like you'll really just get a hard time from the receiving end over the phone. So make sure that you know the rationale of why we're doing certain things after a ward round. Triaging ward jobs, once you're done, often in big teams like Gen Med or Gen Surg, we tend to sit down and do what we call a paper round. We just sit down, talk to each patient, talk through the jobs that we need to do. And it's important to prioritize what needs to be done. Bloods, cannulas can be done later. Things such as imaging or consults should be done early in the day to avoid the queue, especially imaging, because if you really wanted that CT abdo, CT head and neck to be done on the same day, you'd be better calling them early, because a lot of the other teams, medical teams particularly, by 10 or 11 when they're done with ward rounds, they'll start calling to request CT scans. So it's best to get those done early. Same with consults as well. I tend to do imaging and consults as the first thing to do, just because the consulting registrar would have time later on to be able to sort out his or her day in regards to seeing their patients, seeing emergency consults and seeing inpatient consults. So that makes it easier for you guys as well. I don't think there's a set time when you should call a registrar. Some people, don't call till 9 or 10, they'll still be around. And look, it doesn't matter. I think I get calls 6 a.m., 7 a.m. in operating theatres. Like, it's fine. If we don't pick up or we can't talk, try again. It's important for you to be the patient advocate and make sure that these things get done. Which leads to the second thing in regards to ward jobs is for you to take responsibility to make sure that they get done. For us, it is not enough that you said, yes, I've already spoken to the radiologist to get the scan, or yes, I've spoken to cardiology to review the patient and alter the anticoagulation. If it's not done on the same day or the next day, it's not done. So it's a common pitfall where you call and you expect these jobs to be done and not. Like, there's no point you calling, but then no action gets done. So I think it's important for the intern, or even me at my level, to as a registrar, to make sure things get done, regardless of how hard it is. So if you made a consult, that's why it's important to do the consults early on as well. So by 1 or 2 p.m, you read the patient notes. They haven't been seen by cardiology, haven't gotten their scan, or even 3 or 4. Then you call them again. It's like, hey, look, we'd appreciate if you see this patient today because we need input because it's urgent. It's semi-urgent. So often a lot of people, a decent amount of interns would be fairly defensive when we're like, why hasn't scan been done? I've already called cardiology. I've already called CT. But it doesn't matter. It hasn't been done. So I think it's important. Hopefully I've hammered that point, that if you order a test or you request for a consult, that is your responsibility to get it done. But for me as a registrar, it's sort of like the middleman of the group between interns and the boss. I still have full responsibility. At least that's what I think. So me as a registrar, I'll keep pestering. Hey, is the CT scan done? Hey, are the bloods done? What is it like? Because I need to know it. Because when bosses ask me or the patient deteriorates, I know everything about the patient. So ideally, it's in a situation where you as an intern or a resident, you know the minute-to-minute things that happen to each patient. And when we ask, you know. Like, you're the eyes of the ward for us, because we'll be either in operating theatres or seeing consults or in clinic, so we can't man the ward all the time. Remember that communication, I think it's a two-way street. I think it's important for you to communicate to us, particularly when the results happen. For example, the CT scan's done, or the cardiology consult's done. Doesn't hurt to drop a text, hey, cardio's already put the input, this is what's going to happen. Or this is the CT scan, not reported. I'm not sure how to interpret it. Would you mind having a look? Just do a texting is a non-intrusive way that gives us time. But if it's an urgent thing, or something like, a patient's bleeding post-op, give us a call. Especially when you're an intern, regs are quite receptive to calls. It's not that reg to boss dynamic where we're a little bit, should I call? Should I text? Nah. You're an intern. Don't be afraid. Call your registrars. Even if they annoy them, that's their responsibility to sort out any potential medical emergencies. Any clinical review, let them know. Any PACE calls or med calls, definitely let them know, either by a phone call or a text. And then I think the second thing, which is another part of communication, is when you do consults, on where you make phone calls to other colleagues. I think it's been undersold how important summary skills or healthcare communication skills are to interns because we talk about the sciences, we talk about the diagnosis and management a lot, but really, I think from what I've observed in my short couple of years as a doctor, the way that you're going to be judged or assessed by other people, by your bosses, by other colleagues, is how good you are in communicating clinical handover. How are you going to portray that question, or asking for help, or summarizing a patient management to your boss? So when you do a consult, which is, certainly almost going to be an everyday thing, whether you're going to call gastroenterology, rheumatology, or ordering imaging, you need a specific question, a specific objective. And that's why it's quite important for you to stick to the ISBAR: introduction, situation, background, action, response, or reflection. When you call, introduce yourself. A decent amount of people don't introduce, hey, can we get a consult? Hey, can you come to hospital? And I'm like, who are you? Why are you calling me? It's just common sense. But some people, particularly in stress, especially when you start being an intern, things often go into a blank. Before you consult, I recommend you write down, as a beginner, write down everything you want to say. And then the next thing you want to say is the situation or the question that you're posing to the team. Right? So it would be, hi, this is Richard from the geriatrics intern, or would I be able to get an ENT consult for dysphagia or a consult for ear pain? Or if you're calling cardiology, hi, I'm Richard, the geriatrics intern, would I be able to get a consult for a new onset rapid AF? So that sets the question quickly. More often than not, a lot of people just go through the story, particularly when they start, oh, this is Richard, the geriatrics intern, calling ENT. Oh, he's an 87-year-old chap who's presented 2 weeks ago because of acopia, a fall, and a small subdural hemorrhage, which we consulted neurosurgery, and to manage the subdural hemorrhage conservatively, blah, 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 blah. It'll take a minute or two before they actually get to the question, oh, yeah, and then 2 days ago, this chap noticed some hearing loss, and they're like, oh, so you have to troll through 2 minutes and you lose attention. And in this situation, I would usually cut you off. I'm like, what's the ENT question? Because us as surgeons, we're pretty impatient, as you know. So that's why it's really good to just shoot the question immediately. Imagine yourself as that boss or as that registrar who gets woken up 2 a.m. at night. I'm not going to listen for you saying all that story for 2 minutes. I want you to tell me why you're waking me up at 2 a.m. So you tell me, hey, this is Richard, the ED intern. Would we be able to get an urgent review for stridor and potential airway obstruction? Oh, that's going to wake me up. And then you tell the story because I'm paying attention. Or, oh, hey, this is Richard, the intern from ED, calling you to urgently review a 3-year-old kid with a post-tonsillectomy bleed who's actively bleeding. And I'm like, ooh, I'll wake up. Right, so I'll be listening to your story and I know exactly the things I want to hear, or I will ask the exact things that I want to know. And they'll sort of let me triage the situation and give you good advice, even if it's 2 a.m. at night. So it's quite important. And try to make sure that you implement these as well when you're communicating with colleagues too, when you're communicating with a registrar, or you're communicating with your boss, for example, later on when you're a reg. When you see patients in clinic, it'd be like, oh, boss, this is a 52-year-old chap with chronic sinusitis, with polyposis. He's had an X month history of blah, 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 and blah. Trialed all these medication, hasn't really worked. This is the examination. This is what I want to do. And when you communicate, I think nothing grinds people more than say, oh, can you please help? Without having any sort of plan. So when you communicate or ask for help, particularly with a registrar or a boss, have some sort of idea and be honest as well. Like if you don't know, just say, oh, I don't really know what's happening, but to try and rule out the differentials, I'd like to do A, B, C, and D. You see the difference between I don't know versus, oh, look, I'm not really sure, but I'd like to do this, and this. At least that shows that you're thinking and you are taking initiative, and that's a good thing. Because as an intern, resident, registrar, you're not expected to know everything. I'm still clueless in a few things, and I'll admit when I don't know. But at least have a plan. Roughly know what it is that you want to look for, and your registrar, so your boss will guide you to the right way. So it's just about looking good as well, which follows the next thing, which is optics. Optics is something that we are not sort of like told enough about, like how we present ourselves and how we talk to other people. This is a concept. Optics is a term of in the corporate world, because you have to network, you have to impress people to get promotions and all that stuff, and that's similar to what we do, but we're not. These optics are not, creating our own brand is not something that a lot of people talk about. It's all about making sure that you look confident when you communicate, you know what you're doing, and even if you don't, you have a plan. I think it's quite important, because in med school, right, like when you do your OSCEs, your examiner will sit down and listen to you, take a history exam and summarize. But in real life, 99% of the time, your regis, your bosses, the other colleagues is not going to see you take a history and examination. So they are relying on your communication, on your clinical handover to formulate a plan. So sounding confident, having a plan, and not stuttering. I think these are the small things that a lot of people will judge you on, and first impressions count. I think it's very hard to break first impressions when you've already had a bad impression of that. So it's something to be conscious about. Fake it till you make it. Even if you don't know, appear confident. You'd rather be confidently wrong than unconfidently wrong. It's like, oh, what's the answer to this? I'm like, oh, I think this is this, but I'm not sure. As opposed to, what? Oh, I don't know. Oh, indirect hernia. There's a difference, right? There's a difference between how you're going to perceive. Yeah, you're wrong, but that's that. Because you're not expected to be correct all the time. I think the last sort of pearl that I want to relay as well is mistakes. Be accepting of mistakes and reflect on it. We all make mistakes, whichever level it is, intern, resident, registrar, fellow, boss, we will make mistakes. I think the things to know about it is making mistakes is inevitable, and two, it sucks. And 3, the best thing you can do from a mistake and admit it and learn from it. Because there's nothing stupider than making a mistake but not learning from it. I think, for example, my first year as an unaccredited registrar, I pulled the drain too early, didn't communicate with the bosses, and then they got a bit annoyed by it because it was implied that they want the drain out, but it turns out they didn't, and I didn't ask specifically. So admit that mistake, right? Sorry, boss, I pulled the drain. Patient's fine. I'll learn from this experience. Won't happen again. I'm usually the more sort of like, the soft, less assertive side compared to the more aggressive person. So I'd probably just take my head down and say yes. Because often when you have a mistake, you'll appear. Often the natural reflex is being defensive, and being overly defensive does not look good in front of the bosses or your registrars. It's just going to make you look less trustworthy. To be honest, the less jobs we give you, the less we trust you. I think that's the general consensus from me speaking with other people. So accept the mistake. Sorry, I'll learn from that. And the most frustrating part is making a mistake when it's not your mistake. It's the worst part. And these are the kind of things where, even though, it sucks, as a junior, roll with the punches, say, sorry, boss, I'll make sure this gets done now. I'll make sure this gets done better next time. I think it's just more of humility and just sort of knowing that, there's a lot of things that you can't control. But then don't take it personally just because, even if it's a mistake that you didn't make, you're that point of contact. So if someone's going to get pissed, they're going to be pissed at you first. Unfortunately, that's life, regardless of where you are. Medicine, business, anything else. So that's generally my tips and tricks. I'd be happy to field any questions, but unfortunately I've recorded this and I'm actually in a flight back to New South Wales. But I hope this has been a bit helpful and get you a bit more prepared for internship. any questions, just send them to Lucy and I'll try to answer it as much as I can. Thanks, guys. Bye.